My dad is a Ukrainian war refugee. He's been here for the last 3 years. And 3 weeks ago, I opened a letter that said his Medicaid, the government-sponsored medical program that's been covering his chronic medications, medical supplies, and his cancer treatment, is ending on October 1st. If someone in your family is a refugee on asylee or here on humanitarian parole, a legal non-citizen and non-green card holder immigrant, I need you to hear this now, before October 1st rolls in. Because for the majority of these people, they're about to lose this insurance and the out-of-pocket cost is simply prohibitive. I want to be honest with you about what that letter actually did to me, because I think a lot of you are about to feel it too, or already are. My first reaction wasn't, let me solve this. It was complete disbelief. I read it and reread it, and I genuinely could not accept that this was real. It took me 2 full days just to confirm this was actually true and not some mistake. And then it took another 2 days after that to let it sink in. There was fear, real fear, about losing access to his treatment and about what an out-of-pocket immunotherapy bill would even look like for our family. And underneath that, honestly, a feeling of being lost, not knowing where to even start looking for help. I haven't told my dad yet. I'm not going to sit him down and say, your insurance is gone, with nothing else to offer him. I want to soften that blow, to be able to say, yes, this changed, and it's not what you had, and it's not ideal. But here's what I have found and what I'm doing, and it's not a hopeless situation. And that's what today's video is about, how to face this reality and the real solutions I have found. Just like every hard thing I've come to face in the 30 years I've lived in this country, at some point you collect yourself and you start working through the problem. I called on my own clinical network, the people I work alongside every day, and asked flat out, what are you seeing your patients use when this happens? By the end of this video, you'll have the same list what programs generally still cover the uninsured person at a truly low cost, including medications and medical visits for chronic diseases, as well as specialty medication coverage by the programs that almost nobody in our community knows about. And I will provide you with a checklist you can act on this week. My name is Slava. I'm a nurse practitioner. I see homebound patients for a living, and this is the exact plan I built for my own father who is about to lose his insurance. So let's get into it. Here's the short version. A federal law called H.R. 1, signed in July 2025, changes who qualifies for Medicaid. Starting October 1st, 2026, certain lawfully present immigrant categories lose eligibility for full Medicaid. It includes refugee, people on humanitarian parole, including Afghani and Ukrainian refugees. This is not about income. You and your family member could have qualified financially every single year and still lose coverage on this date purely because of their status category. Children, pregnant women, green card holders past the 5-year mark, and Cuban entrants are not affected by this law. If that's your situation, some of this still applies to you, especially the medication programs, but the timeline is different. One thing does not go away: emergency Medicaid. If you or your family member has a true life-threatening emergency, heart attack, stroke, a bad fall, active labor, emergency rooms still have to treat, and emergency Medicaid still covers it, regardless of status. What it does not cover is ongoing stuff: the blood pressure pills, the diuretics for your edema, the diabetic treatment, and routine visits. That gap we need to plan for. First thing first, before that date hits, get every appointment on the books before October 1st. Now, PCP, cardiologist, endocrinologist, whoever manages the chronic conditions of your family member. Number 2, ask for 90-day refills on everything, not 30. Ask what durable medical equipment or supplies might they need in the next year and get it ordered now while it's covered. If they're connected to a support planner or case manager, ask them directly what happens to any home-based services on that date. Don't assume, ask in writing. Okay, here's what I find out from calling around my clinical network. Searched the internet, then verified myself. For the everyday medications, hypertension, edema, thyroid, that kind of thing, GoodRx just launched something called GoodRx Companion. It's $14.99 a month, no insurance required, no immigration status question anywhere on the form. It includes over 200 common generic medications completely free, plus $19 televisits if you need your prescription renewed, or a quick medical opinion. Lisinopril, metoprolol, a lot of the standard blood pressure medications and thyroid meds are on that free list. Another low-cost option, and you don't even need a membership for this one, Walmart's $4 list that's been running for almost 20 years and it's still active. About 300 generic medications, $4 for a 30-day supply and $10 for 90-day supply. No insurance, no citizenship questions, no income form. Blood pressure, thyroid meds, several mental health medications are on it. Call your Walmart pharmacy and just ask them to check your specific medications against that list. It does change from time to time. For ongoing medical care, the actual doctor's visits, federally qualified health centers are required by federal law to see patients regardless of immigration status and regardless of ability to pay. They use sliding fee scale based on income. These aren't a downgrade. They're real primary care with real providers, and many of them have on-site pharmacy and case management too. You can check the availability of such centers in your area. Just enter federally qualified health centers in the Google bar. If you end up needing hospital level or specialist care, every nonprofit hospital is required to have a financial assistance, charity care policy. It's income-based, and immigration status is not disqualifier at most hospitals. Ask the hospital's financial counselor for the charity care application before a bill gets sent to collections. Do this proactively, not after the bill arrives. About the marketplace question, because you'll see this floating around. If you or your parent is legal immigrant, refugee, asylee, parolee status, you can still buy an unsubsidized plan on Health Connection during open enrollment this fall. I want to be straight with you. Starting in 2027, federal subsidies are being cut off for exactly these categories, so the price goes up next year. But locking in plan this open enrollment before the change lands is worth a real conversation with the state Health Connection navigator. If cancer treatment, including immunotherapy, becomes part of the picture, this is important to understand correctly. Programs like the HealthWell Foundation, Cancer Care, and the newly merged Total Assist that the Patient Advocate Foundation and Penn Foundation combined are copay and premium assistance. They help cover the gap on top of some existing coverage. Most of them aren't designed to pay for cancer treatment from zero. So the sequence matters. Get to federally qualified health centers or marketplace plans first for some baseline coverage, then these additional funds to close the remaining gap. Some states also run breast and cervical cancer programs specifically for those diagnoses, worth knowing about for the women in your family. And this one almost nobody thinks of. Go straight to the manufacturer. This is the piece I want you to really hear, especially if immunotherapy or any high-cost specialty drugs is in the picture. The pharmaceutical company that actually makes the medication almost always runs its own patient assistance program. And most of them are built around insurance and income status, not immigration status. Merck, Pfizer, Novartis, and most other major manufacturers have a foundation or program that will provide medications free or heavily discounted to patients who are uninsured or underinsured and fall under the income limit. And for oncology drugs especially, that income ceiling is often generous. As one example, Merck's program can provide Keytruda, a medication to treat lung cancer, at no cost to qualifying uninsured patients. And that single medication can run over $13,000 a month retail. Ask oncologist or oncologist social worker directly. Does the manufacturer of this drug have a patient assistance program? They deal with this consistently and can usually submit the application on your behalf. Also worth knowing, Needly, Meds, and Prescription Assist are two free directories that list these programs by drug name if you want to search ahead of time. Here is your list for this week. Number 1, book every appointment before October 1st. Number 2, request 90-day refills and any needed equipment now. Number 3, call your local federally qualified health centers and ask about sliding scale enrollment. Number 4, look up GoodRx Companion and check your or your family member meds against the free list. Number 5, call your Walmart pharmacy and check the $4 list. Number 6, if a specialty or oncology drug is involved, ask the doctor about the manufacturer's patient assistance program. Number 7, call your state health connection navigator about fall open enrollment. The call is free. Number 8, ask the nearby hospital system for their charity care application. Better know before you need it. I still haven't had the conversation with my dad, but for the first time since I opened that letter, I'm not walking on eggshells anymore. Feel free to download my checklist that walks you through all of this step by step. The link is below. Grab it before October hits. And if someone in your circle is quietly panicking about a letter just like this one, send them this video. You might be the only person who tells them that other options do exist and what still works. Reach out to me in the comments and if this is affecting your family too. I will be happy to help you navigate this difficult situation after I deep dived in it myself.